In the past several months, Microsoft has laid off 6,500 people. Tech in general is having a lot of layoffs, so that includes a lot of dating apps, strangely enough. I guess Tinder and Hinge have been laying off people like crazy. Some of this is due to AI, but there's something else going on. Some people are saying recession, but we have had month-over-month growth in the second quarter of the year, so some people will say no, not a recession. What I do know is that it's not just tech. Healthcare is seeing cuts too. The VA, for example, has had some cuts to it. The VA, already one of the most inefficient institutions in the country, already one of the most poorly run institutions in the country, one of the most wasteful institutions in the country. The VA that will give full disability to people for apparently no reason whatsoever. The VA really needs to be restructured, but because of these cuts, following Medicare's lead, because Medicare just had a bunch of cuts too, reimbursement for healthcare workers like myself, I'm a home health therapist, is going by the wayside. So it is harder to get reimbursed as a healthcare worker for the work that you do, especially in home health. There's extra documentation required. The rules for what qualifies as skilled services are changing. Billable visits are changing by definition. And there's a lot going on there that's causing healthcare companies to struggle. And I'm going to start in the home health sector because that's where I work primarily. I also work in a hospital, but in home health, companies have been cutting down because they anticipate, because the documentation needs have changed, there's going to be a period over the next couple of years where a lot of visits, a lot of work goes unpaid for because the documentation, so for example, if they tell me you need to document A, B, and C, and I've been doing that for several years, and then they all of a sudden Medicare changes the rules and says you need A and C, but instead of B, we want you to document D, E, F, and G. And I either don't have time, I don't understand, no one tells me, poor communication, any reason under the sun, if I don't turn in the documentation that they want, we don't get reimbursed. So in anticipation of clinicians not really understanding what's being asked of them, a lot of home health companies in particular are cutting the fat anywhere they can. And usually it's not fat. Usually it's necessary workers. The company that I work for, I was told they cut 20,000 people company-wide. My branch was cut down to 3 employees. We had no office workers. We had no manager. We were being managed from far away by corporate. There was myself, a physical therapist, and a nurse. Only the 3 of us were left. Our manager was let go, medical records, office workers, physical therapy assistant, occupational therapy assistant, gone. And that was just one small branch. And then now, they ask more of us to cover in the gaps, of course. Now, we're on the upswing, we're getting people back in, but I say that to illustrate the point that Medicare cuts and VA cuts, and those are the most relevant here. The number one payer for home health companies is Medicare. Other health insurances follow Medicare. So when Medicare changes their documentation requirements and says, we want this, a few months down the road, the other insurances are going to follow suit. And that means that this is going to be extended a little longer until those insurances settle on what it is that they want from healthcare workers. Now, another part of this is the hospitals. Hospitals are having trouble hiring people, and this has been the case since COVID. Hospitals were paying huge amounts of money to nurses and nurse aides. Therapists, not so much. We didn't see much hazard pay. Even in some cases, doctors didn't see any hazard pay. It was only nurses and nurse aides. I'm thinking of a particular hospital that I worked in. In that hospital, nurses and nurse aides were the only ones getting the government hazard pay. None of the rest of us got a bump. That pay encouraged these people that, so you think a nurse aide will make anywhere from like $12 to $19 an hour at the extreme high end in the region that I'm in. And a nurse will make between 23 and up to 40, depending on if they're an LPN or an RN and what setting they're in, and if they're in a critical access place. There's a lot of factors that go into it in healthcare. Some nurses were making upwards of $60 and $70 an hour. Some nurse aides, in fact, at one hospital in a bigger city that I worked at when I was doing clinicals, some of the nurses that were making $100 an hour with the hazard pay. And nurse aides were making up to $30 and $40 an hour. So what happened was the lifestyle of these people inflated like crazy. Like I said, it wasn't just nurses and nurse aides, because in other places, some other employees got some hazard pay, but it was primarily nurses and nurse aides. And this is why there's such a nursing shortage, because the nurses inflated their lifestyle, and then realized as soon as that hazard pay got yanked, oh my God, I can't pay my $800 car bill. I can't pay this, $3,300 mortgage. So what do? Well, the only thing that they could do that wasn't going to drive them to bankruptcy was to go get a travel job. They would do contract work, which is much less stable. And when money starts to become scarce, the first people that get cut are contract workers. If you go on TikTok, and I got the idea to talk about this from Caleb Hammer because he went over a bunch of TikToks a few days ago from nurses that were like, I just lost my job, I lost my job, I lost my job. And most of them are contract nurses. And the reason that they're losing their job is the contract nurses get paid well above what a regular nurse would get paid, sometimes even 2, 3, and 4 times as much. When you're taking in that kind of money, yes, you're going to be the first one gone. It doesn't matter how good of an employee you are. If they have someone that they can pay half and they can still sign off on a note, they're going to take that. And these Medicare, VA, and insurance cuts affect hospitals too. Now, hospitals have it a little easier because they have some wiggle room with tax write-offs, because a lot of hospitals are nonprofits, so they can just write off a whole bunch of, and the private companies can do this too, but hospitals have a lot more leeway because they're subsidized. They can just deal with, non-payment and things like that from time to time. Not so much the private companies. They won't even show up if you don't have insurance coverage. But hospitals were less affected for a longer time than some of the other settings in healthcare. But my God, now we're at a point where the hospitals are getting affected. And hospital salaries are already pretty bad. Like for instance, where I work in home health. If I went and switched to a hospital, I would take almost a 20% pay cut. It's crazy how different those are. So as the hospitals start to struggle with being able to, they kind of blew their loads during COVID, so to speak. And everybody was like, oh God, all this money in healthcare, and it was fake. And now there are also a lot of people that went to school, they got nursing degrees. And don't get me wrong, nursing pays well. But it doesn't pay well enough to have the TikTok lifestyle, the Instagram lifestyle. And a lot of people were seeing during COVID, and I know you probably saw too, the TikTok and Instagram nurses out there talking about how much money they made. I saw so many of these and it made me really mad because it was all hazard pay that they were getting. And so a whole bunch of people went and got nursing degrees and realized, if you live in, bumfuck Midwest, you might be making $25 an hour at the high end at some of these facilities. So all of a sudden, you go in, $70,000 of student debt for a nursing degree that's going to pay you half of what you were expecting. That's scary. That's really scary. And especially the ones that, went and got a bachelor's and then an LPN, like a bachelor's in something else and then an LPN when they were in college. So you get $60,000. What is the average? Like $40,000 in debt for a bachelor's, which isn't actually terrible if you get a good job. And then, you go and get an additional $20,000, $30,000 to go get your LPN. Well, now you're $70,000 in, and you're actually probably making less than you would at a good sales job. That's just the fact. So there's people that are now just like, holy shit, I can't pay my student loans. I can't pay my student loans, my kids' bills, my bills, my car payment, my rent, like all of this stuff that it just gets to be too much. And there are more layoffs coming. I'm holding on to my job with both hands because I'm working on a doctorate. I'm working, full-time one job, and I'm working part-time another. And I'm doing it on purpose because I know that I need a hefty emergency fund working in healthcare. Now, I have a unique spot where I am, I think, needed by the people I work for. I hope I am, but I'm a little too cynical to believe that I can't be laid off. I can't be let go. So, stack the emergency fund. So if you're in healthcare, and in fact, in most industries, think about trucking with the tariff laws, which is going to carry over to warehouses, and that's going to carry over to general retail. It's going to carry over to everything. You better have an emergency fund, and you better pay off your debt as fast as you can. And I would add, it's probably a good idea to have a solid fund set away in some sort of asset that isn't going to depreciate with inflation. Because if indeed we are headed toward another 2008-esque recession, which is what the financial experts say, every 20 years, here it comes. People aren't going to be ready. This is going to be a disaster. I can't think of any generations that are less prepared for a recession than Gen Z and millennials. I can't think of anybody who's less prepared. So I just wanted to talk about that as something that had been kind of in the back of my mind for a while, and now that I'm seeing more and more videos crop up about it, I wanted to put my 2 cents in. So if you liked the video, give it a thumbs up, share it if you thought it was interesting, and subscribe if you're not subscribed. I'll talk to you next time.